The Comprehensive Stroke Center is completely committed to upgrading the health of our region, improving healthy lifestyles, reducing risk factors, improving education in the communities and in the families of those patients. So that's our commitment as a comprehensive center.
We have to reach out to every part of Kentucky. We're a great state, but we're a rural state, and we value the beauty of Kentucky. We value our geography, but at times it is an impediment to providing people with the very best in healthcare. So we see this as our job. We see it as our responsibility.
We work in a hub and spoke model. What that means is that the University Hospital and the Downtown Medical Center serves as the hub. So this is where the most sophisticated and highest expertise, the most technologically demanding services that we provide are located. For patients who live in more rural areas and within their town or community may not and probably do not have access locally to such treatment approaches. But what we are able to do is provide, through a telemedicine model, the ability to provide those expertise locally.
Hello, Ms. Bryant.
Dr. Shafer.
Hi, how are you doing today?
I'm fine, how are you?
I'm doing pretty well.
So not only can I see patients who normally would not be seen by a neurologist, but I can see a patient quickly, in many cases more quickly than a local doctor can drive to the hospital. I can be there within minutes. I can see the patient promptly. We can make diagnosis, we can order tests. But more importantly, in the acute setting, the patient gets to stay in their home hospital.
The goal with a network of care in a comprehensive stroke program is to keep patients in their home hospital if at all possible.
Touch your nose with your right index finger.
Not having a neurologist or a stroke specialist on the staff in this hospital, we feel very delighted to have such help readily available.
If we did not have our relationship with the University of Louisville, it would be more difficult for us to take care of those patients. But because of that relationship, we're able to save people's lives and have better quality of life.
One of the ways that we are improving our partnerships with regionalization in stroke care is through working with the public health department to provide continuum of care post-discharge. University of Louisville is partnering with them to follow patients who are discharged home after a stroke by having a health department nurse go into the home at 2 weeks, 3 months, and 6 months to look at risk factors, re-educate on stroke symptoms, and also engage the family and other caregivers in the home as well as the community in stroke prevention. We've only had a pilot project for 1 year, but what we're really trying to focus on is bridging that gap between acute care and public health.
We are all out there trying to get our word out, and we are all passionate about stroke, that we need to have this stopped.
At the University of Louisville, the neurologists, neurosurgeons, physical medicine rehabilitation, psychiatrists, ophthalmologists, urologists, and many other clinicians have all come together in an institute model. And our goal is to deliver a multidisciplinary care to our patients in a way that's patient-centric.
Here we look at every single patient every time to see if there is any type of treatment that we can prevent the stroke from either getting better or if there's any reversible treatment that we can add to the patient. And it takes a group of people that are committed, that can take the patient and open up blood vessels, to provide the blood flow to the brain as soon as possible.
I think one of the things that we offer, being a comprehensive program, is every commitment that we make is to the continuum of care of those patients. So it's not just a one-time situation, but it's a lifelong commitment to the continuum of care.
We're just very fortunate to have Dr. Remmel leading this program, and we're proud of her team that she's recruited. She's recruited some of the best people from across the country and really built an outstanding program that we're very proud of.